Picture this. You're carrying this incredibly heavy, completely invisible weight around with you every single day. Now imagine trying to tell people about this weight, only to have them look at you, looking perfectly healthy on the outside, and essentially tell you that the weight doesn't exist. Listen, if you're a fit, healthy person who hits the gym, eats well, and bounces back from tweaks and injuries, it can be really, really hard to wrap your head around a kind of pain that just doesn't show up on an X-ray, a fancy scan, or a standard blood test. But here's the big question we need to ask ourselves. Just because we can't see it, does that mean it's all in their head?
Welcome to this explainer. Today, we're taking on a really crucial mission. We're going to literally unmask the invisible pain of fibromyalgia syndrome, or FMS for short. We're going to break down the hard, objective science behind this condition, and I mean the actual physiological, biological mechanisms at play here. We're going to look at what fibromyalgia actually is, why it demands a completely different approach to self-care than what you or I might be used to, and we're going to objectively prove why this syndrome requires rigorous management and, honestly, our genuine empathy.
All right, here's our roadmap for today. First, the reality of invisible pain. Second, the syndrome's snowball effect. Third, the triggers and cascading diseases. Fourth, proving the pain is real. And finally, why self-care matters most. Let's get right into it.
Starting off with Section 1, the reality of invisible pain, more than just aching muscles. So for a really long time, fibromyalgia was dangerously misunderstood. People, and even doctors, thought it was just a localized muscle issue, calling it fibrositis, like it was just some temporary inflammation you could massage away. But modern science? Yeah, it tells a radically different story.
Fibromyalgia is astonishingly common. We're talking up to 5% of the entire population. It's defined by this chronic, widespread musculoskeletal pain that just lingers, sometimes for years. And here's the real kicker. There's no simple physical injury to blame. You can't just point to a torn ligament or a broken bone. Because the pain is totally invisible, patients wait an agonizing average of 3 to 5 years just to get a correct diagnosis. Imagine doctors constantly dismissing your pain as just stress. It disproportionately affects women, but make no mistake, it severely impacts men and kids too. It's a full-body chronic pain condition.
So to truly grasp what's going on, we have to look deep under the hood at the central nervous system. The main culprit here is a phenomenon called central sensitization. Okay, think of your nervous system like it has a volume knob for everyday sensory signals. For a healthy person, a light touch, a temperature change, or tight clothing registers at a volume level of, say, a 1 or 2. You barely notice it. But for someone with FMS, their brain and spinal cord are making massive processing errors. Their volume knob is cranked all the way up to a 10. Normal sensations are wildly amplified into severe pain. This is absolutely not a psychological state. It is a profound, hardwired biological dysfunction.
Which brings us to Section 2, the syndrome's snowball effect, a whole-body crisis. You see, the widespread pain we just talked about, that is literally just the tip of the iceberg. Now, what's really interesting here is how everything connects. Looking at this alert factors wheel from the clinical guidelines, you can see the widespread pain at the top, but follow that circle around. It's inextricably linked with intrusive fatigue. And I'm not talking about needing an afternoon coffee. I mean bone-deep, heavy tiredness that a full night of sleep just does not fix. And right over there on the left, poor concentration. Patients universally call this brain fog. It's a brutal cycle where neurological, physical, and cognitive barriers are constantly feeding into each other.
When you actually break down these overlapping symptoms by the biological systems they affect, the sheer volume is staggering. Neurologically, they're dealing with that heavy brain fog, tingling, and extreme hypersensitivity. Gastrointestinally, a huge percentage suffer from irritable bowel syndrome, or IBS, battling constant nausea and severe stomach issues. And their sleep architecture is completely wrecked. They basically never reach those deep restorative sleep phases, so they wake up trapped in severe fatigue with virtually zero energy. I want you to really imagine that for a second. Battling widespread muscle pain, a constantly upset stomach, total sleep deprivation, and an inability to think clearly, all at the exact same time, every single day.
Moving to Section 3, triggers and cascading diseases, the downward spiral. These symptoms don't just exist in a vacuum, right? They interact with the real world, triggering a dangerous cascade for long-term health.
First, we need to talk about what actually sparks a flare-up. Research shows the initial onset is often triggered by physical trauma, like a major car accident, an infection, or surgery. But on a daily basis, everyday things are agonizing triggers. Extreme stress, obviously, but also environmental factors.
Because that nervous system volume knob is broken, a cold draft isn't just a chill, it feels like ice picks in their joints. And sensory overload? Walking into a room with loud noises and bright fluorescent lights doesn't just give them a mild headache, it overloads their entire system and sends shockwaves of pain through their body.
And here is how this whole thing snowballs into a downright dangerous situation. Step 1. The chronic pain, brain fog, and severe fatigue absolutely destroy a person's tolerance for exercise. Step 2. This essentially forces them into a highly sedentary lifestyle just out of basic self-preservation. Step 3. Because they can't move without severe pain, profound metabolic changes happen, and patients often become overweight. Step 4. That excess weight and inactivity sharply increase the risk for serious, life-threatening comorbidities. We're talking type 2 diabetes, severe circulatory problems, and major cardiovascular disease. The syndrome literally morphs from an invisible pain disorder into a highly visible, life-threatening metabolic crisis.
Okay, Section 4, Proving the Pain is Real, the Hard Evidence. For anyone, especially my folks in the fitness community, who might still secretly be thinking, come on, maybe they just need to toughen up and push through it. It's time to look at the undeniable hard medical proof. In clinical studies, researchers measured out exact amounts of pressure to apply to subjects. For a healthy person, 2 pounds of pressure per square inch is basically just a firm touch. It's a handshake, zero pain. But when you apply that exact same 1.5 to 2 pounds of pressure to an FMS patient, their brain registers an acute, highly significant pain response. It's not an exaggeration. Their body is literally processing the physical reality of the world differently than yours does.
But wait, it gets crazier. To completely eliminate the whole subjective "I feel pain" argument that skeptics love to use, researchers used EMG tests to measure electrical activity in the muscles. You know how if you touch a hot stove, your hand pulls back before you even realize it's hot? That's a spinal cord reflex. Tests show that when FMS patients receive sensory stimulation, their muscles involuntarily twitch in a pain reflex faster than the signal can physically travel to the brain. It bypasses the brain completely. This definitively, scientifically destroys the "it's all in your head" stigma. The hyperexcitability is objectively real, and it's happening right there in the spinal cord.
Finally, Section 5. Why self-care matters most, a non-negotiable requirement. Because this pain is so deeply hardwired into the nervous system, managing it requires a completely unique strategy. Self-care is not a luxury here, it is literally a requirement for survival.
If you're a fit person, your whole philosophy is probably no pain, no gain, right? You tear muscles in the gym, you push past the burn, your body adapts, and boom, you get stronger. But listen, applying that mindset to a fibromyalgia patient is highly, highly destructive. For them, high-intensity exercise rapidly exacerbates their symptoms. Their central nervous system can't adapt to that stress. It just short-circuits. Instead of aggressively pushing limits, they must strictly and meticulously pace themselves. They have to carefully calculate their daily energy just to avoid triggering a systemic flare-up that could leave them stuck in bed for days.
Now, movement is actually one of the best non-pharmacological treatments, but it has to be completely customized. Clinical guidelines strongly recommend highly individualized pacing. Patients see the best results with low-impact, gentle aerobic exercises. Think walking or warm water therapy. They also find massive relief in flexibility and meditative movements like yoga, tai chi, and qigong. Why? Because these actively calm the nervous system down rather than shocking it. And this absolutely has to be paired with rigid sleep hygiene. And by rigid, I mean 0 screen time before bed, pitch black rooms, and strict temperature control to prevent any sensory overload while they rest. This gentle, incredibly protective self-care is their best weapon to stop those cascading diseases we talked about.
So what's the big takeaway here? Fibromyalgia is a relentless, exhausting, 24/7 battle against the central nervous system that has essentially gone completely rogue. It is real, it is objectively measurable, and if it's not delicately managed, it brings on a massive burden of secondary conditions like diabetes and heart disease. So I want to leave you with one final thought. The next time a fit, healthy-looking friend or family member has to suddenly cancel plans because they're battling a flare-up of an invisible illness, are you going to view them through the harsh lens of judgment, or are you going to offer them the profound empathy that their daily reality so deeply deserves?